Hello everyone, let's try to solve this question together. So a head ultrasound is obtained in a preterm infant at a term equivalent age. Term equivalent age usually means when the baby reaches 37 to 40 weeks. Usually 40 weeks is used, but 37 is also a term gestation. And as you guys remember that now these gestations have been divided into different components: preterm, early term, term, late term. So just look at that. So basically the idea is that this baby was preterm and now this is taken as a term gestation. So based on the findings, the infant is at increased risk for, so you have to find out what's the finding and then look at the choices given. So the correct choice here is spastic diplegia. And first of all, before we go into the diagnosis, what do you see here? You see this is like a cystic change, and this is around the ventricle. So because this is periventricular, so this is periventricular leukomalacia. That's the definition, and you see on the sagittal image as well that you see the signs which are compatible with periventricular leukomalacia. And we'll talk about in the next slide why this is high risk for spastic diplegia. So here you go. So these are the four choices given, as you guys have seen in the previous slide. So basically, as you see here, that spastic type of CP is the most common one. Dyskinetic is usually when the lesion is in basal ganglia, and ataxic is when it's in the cerebellum. So just remember that. And because this lesion was around periventricle, as you see here, and as depicted in these two cartoons that look at the fibers that goes to the legs are affected. Same here, you see this is the ventricle, and this is the paraventricle fibers that are affected. So both legs, because this is a bilateral lesion, as you guys see here, so both legs will be spastic, and this patient will have that type of CP. Now what about the seizure disorder? This is a nice article, if you guys can pull that, and epilepsy has been shown to be associated with periventricular leukomalacia. But again, among the given choices, A is the best choice. So you can say that seizure is associated, but A is the best choice. So now you understand how periventricular leukomalacia is associated with type of CP and which type of CP. Of course, read about it. The causes is usually prematurity, hypoxic injuries, and all that. But this is the clinical manifestation. So one has to be very careful in following with the speech developmental and make sure that patient at a high risk clinic appointment done. So I hope you guys have learned something together today. Please do subscribe to our channel, and you guys have a wonderful day. Bye.